Today we'll talk about bioterrorism. The topic for today's lecture was gram-positive rods, and I think the best example that we may have for bioterrorism is a gram-positive rod in terms of anthrax, and the causative agent is Bacillus anthracis. And one of the most important thing that we want to know in bioterrorism is that there are bioterrorist agents there are out there, and we have to create not only public awareness but also awareness among healthcare team that they pretty much know what their response should be if God forbid something of that nature happens. And you can see from these posters that the number one threat in terms of bioterrorism is anthrax, whereas we do have smallpox and we have Yersinia pestis and some other viruses also there. So let's see what is the definition of bioterrorism is. So the most important thing in bioterrorism is that it is a deliberate release. So it's not a natural release that occurs naturally because of a epidemic or because of some other cause, like we normally see usually in winter months. There are a lot of flu viruses around, and people may get higher incidences of flu in a particular area. But this time when we talk of bioterrorism, we basically are talking about a deliberate release by a person, by a group of people, by anybody. So that's a deliberate release of a particular microorganism or microbiological agent, like a virus, bacteria, or as a matter of fact, any other germs or part of the germs in terms of toxins, in terms of any other thing that may cause either illness called morbidity or death called fatality. And this may affect people, it may affect animals, or it may affect plants. So this is the definition of bioterrorism, and at all times CDC and even NIH and the government agencies want all the health related caregivers to be familiar with that and be prepared. So part of the training is usually called preparedness for such a calamity that may befall a community or a city or a country. Now, what are these biological agents that are normally used? Number one thing you have to understand is that most of these agents that are used for creating such a threat are typically found in nature, and it's possible that they could be manipulated, they could be changed to increase their ability to cause a disease. And the problem we have in terms of dealing with these kind of threats is that they are becoming more and more resistant to current medicines, and then once these are released in public in a civil society, their chances are that they can spread very rapidly in the environment. The other important thing is that they can be released in the air, or they can be used in water supply or food supply chain. So anything that can come across the people can affect the outcome of how a bioterrorism threat is dealt with. Now, one of the important questions usually asked is that why would people want to use that biological agent? The reason is that if somebody was to secretly go in a city or in a place where they want to implant or they want to plant a threat over there, and then disappear from the scene, so to speak, a crime scene. So there's an ample time for them. It's not like a conventional bomb or something like that that will explode instantaneously. So you basically can go and release that. It's going to take some time, hours and days, for a person to not get noticed and then again disappear from the scene. So this is important in terms of the use of traditionally biological agents, especially anthrax. But you also have to keep in mind that some, like smallpox, for example, virus, it can be spread from person to person, whereas anthrax that we had this scare in 2001 cannot be spread from person to person. So let me give you a little bit of historical background so that you have a better understanding that this type of bioterrorism is, so to speak, nothing new. It's been there ages, and if you look at the timeline events, you will see as early as 1155 when the uh, Roman emperor of that time used the bodies of dead enemy soldiers that were decaying to contaminate the animal well so that water is not used, or if it is used, it's going to become infected. And then again, over years, uh, different nations and different kings have been using that in different forms, where they've been catapulting dead bodies or infected bodies into enemies' castles, or uh, piling up the excrements of, you know, all this organic waste from these dead people, so that it caused problems. And if you look at the history, you'll also see that this wasn't purely for one particular area like Europe or Asia or any other part, but in fact, American history, especially American Civil War from 1860 to 1863, we do see in the memoir of W.T. Sherman that described that Confederates were poisoning the ponds by tossing carcasses of dead animals in them. And then even to such an extent that they had one of the physicians that attempted to use even smallpox against the Union troops. So you can see that there have been this kind of a crude, we call crude use of biological agents over time in many different parts of the world. And this kind of activity in terms of, so to speak, non-conventional way of utilizing a source that can affect people and that can jeopardize the life of even a civil society. But this has been demonstrated, and you can read the historical events all over the world. Even you can see in some parts of the world, for example, in this particular slide that you're looking at right now, is that there have been different cults, different small organizations, sometimes a single person or a group of people, where they wanted to, for example, contaminate restaurant salad bars with Salmonella typhimurium, or use, for example, let's say Ebola virus, that's pretty dangerous though, or use any other toxins like botulinum toxin or Q fever or Ebola in Japan and many different parts of the world. But the recent memory that most of us have is the anthrax contaminated letters. They were basically sent to the people, and also keep in mind that these, especially Bacillus anthracis, has the capability of forming spores, so they can exist in the form of powder, and people are going to open that powder, they're going to touch it, and they will inhale it. So there are chances for cutaneous as well as respiratory anthrax. And those of you who did follow, especially these anthrax contaminated letters, they pretty much found out that they can go and find out the strain and trace back the strain to a particular lab or a research lab, where there are a set of people that basically have an authority to use it, and then can be traced back in terms of where the origin of that particular virus or particular bacteria or any other microorganisms can be traced to. This slide will tell you again historically that in July of 1763, you see that there was a plan that they tried to inoculate the Indians by means of blankets. So basically, they wanted to put that infective agent to the blankets and pass this blanket on to poor Indians. So they kind of think that you're helping them, but in disguise you wanted to kill them. And then again, uh, this part of weaponizing or weapons of mass destructions that you've been hearing for a long time has been a story even in US military history as well, that war games were being played in Pacific where they would involve some of like caged animals and then release the lethal agents and then again see what the effects are. But they didn't realize that basically in the Cold War between US and Soviet Union, things have been kind of pretty creepy, and they were kind of, both of them were accumulating tons of information and tons of biological weapon for use till 1942, when the officially US began an offensive to basically stop that. And then at that time, when they decided to stop that, especially for anthrax and Bacillus anthracis, they had already produced spores of at least 5,000 bombs filled with that. So that's the historical perspective that you can see for yourself. And then you will also see that there's a chart over here that basically keeps in mind that not only are we interested in terms of what the biological agent is, but we want also to find out what is the ideology behind that particular person or particular group of person or cult, and what is the target, and what kind of agents they have the use, and what's the outcome for that. So the idea is that we want to be prepared for something that we call proactive preparation. So we pretty much would know if such and such thing happens, what is it that we need to do, and we can then plan accordingly. And then going to read out the stories over here of the recent events, and then a nice table over here for your individual reading. It will give you historical perspective of things that may have happened in this country or in the world. Another question people usually ask is that why is it that this biological agent or bioterrorism becomes so attractive to people who want to pursue that course? Well, there are many answers for that. Number one is that they are very easily acquired. So all you need to do basically is, with this internet world, you can just get hold of that microorganism, and you just need like a couple of mils. If you remember, traditionally one of the officers of State Department presented in the to the rest of the world, in the United Nations, that this is enough to eliminate the whole country. So that's true. So you just need a couple of milliliters of couple of bacteria to cause such a havoc in the world. And if you compare that in terms of the cost that you may get for preparing, for example, a conventional weapon or a nuclear weapon, in terms of millions and trillions, you just need $1 in terms of expenditure. As far as their lethality is concerned, again, you will see that they can cause more damage than what a conventional weapon would do. So that always brings caution, that brings preparedness, that brings information for us to know. So other than infectivity is important as well, because they are very infective and they are stable. You not notice it. You can do it in a clandestine way, secret way, an implant, and then even you can use a remote or a delayed kind of way in terms of utilizing that biological agent. If you want to put it in water, put it in food, so it will take some time, some days, some weeks before you will see the effect. So the next question we have to ask ourselves is that how would we know? Because we don't want to panic, because that's another important thing in terms of dealing bioterrorism, is that you should not panic and you should not blow things out of proportion, because panic will cause more harm than the actual bioterrorism agent. So some of the points are important. For example, if you do see that multiple people are ill at the same time, that's what the definition of epidemic is. And then people who were previously pretty much healthy, all of a sudden they become affected, and people become sick, people start dying, and then again they would obviously do a test on them and find out if they can relate the same organism to all the people. So you have to be careful. And then again, at the many times, sometimes there are claims by those terrorists or other parties to brag about what they have done or they plan to do. And then again, you will also see some of the animals dying in the zoo, or some of the other untoward events that may happen may suggest to you. But again, there's a word of caution. So you have to make sure that you do your homework before you declare such an emergency. And normally, what a good response will be in terms, especially if it is a respiratory disease, as we saw in swine flu and bird flu, and many things that you recently saw. And then you see an epidemic, you see a lot of different kind of scenario in terms of symptoms. And then again, you see a pretty much a seasonal difference, that for example, flu will come in winter, and all of a sudden you see that happening in summer. And then also we need to determine the genetics of that particular microorganism that's been used, and want to make sure that we establish the cause of death for those people who may have that problem. Now, what CDC has done is that they basically have categorized quite a few microorganisms, and there's a list of that. You can look at CDC website. They have given almost alphabetically a list from A to Z. So this, they keep on changing that. But the most important thing that I want to talk about today is category A agents, because these are the ones that are easily spread. They can be transmitted from person to person, and they have this potential to cause a major public health impact. So people can panic, public can panic, social life can disrupt, and then create a very big problem, especially for the public health preparedness. I want you to remember 6 important category A agents. Of course, anthrax is on the top, smallpox, botulinum toxin, bubonic plague, viral hemorrhagic fever, and tularemia. Now, interestingly, uh, Bacillus anthracis that causes anthrax remains at the top, and then rest of them are mostly viruses or toxins. If you look at category B, that's just a little bit moderate as compared to A, but we do have a list of category B agents, and you will see uh, brucellosis there, epsilon toxin of Clostridium perfringens there, Salmonella there, glanders, milidosis, psittacosis, Q fever, ricin toxin, Staphylococcus, coccal enterotoxin B, typhus, viral encephalitis, and then there are some other threats that may happen, especially contaminating water supply, like Vibrio cholera and Cryptosporidium parvum. And this keeps on changing depending upon which state, which country are you talking about. But these could be the possible threats. And then again, category C or have a little bit lower than that, and they usually include some of the emerging pathogens that are coming up, but not been categorized into A and B. But nevertheless, let's have a little bit of detail of the agents that I mentioned earlier about the 6 important category A biological agents. So Bacillus anthracis, the causative uh, microorganism for anthrax. This is a encapsulated aerobic gram-positive rod. And again, you can see that it has a capability of spore forming, that it's going to become vegetative. It will be difficult to treat. That's why they make a powder of. It can spread in the environment and cause problem. And when, especially for humans, it's usually happens to animals, but if humans get infected, most commonly they have skin or cutaneous infections. And very rarely they may have respiratory, gastrointestinal, or oropharyngeal form. But we do see mostly skin involved. And then that type of involvement comes from direct contact with the spores. And it's, as I said, they're in the nature, especially if you come across infected animals or any animal products. And if you happen to work with animals, so you may have an exposure as an occupational exposure. And then you can inhale these aerosolized spores. You can eat raw meat and get into your system. But one thing you have to keep in mind is there is no person to person transmission of inhalation or gastrointestinal anthrax. The other important thing for this particular bacteria, Bacillus anthracis, is that if you do see a case, you have to report it. So you not only have to report a confirmed case, but also report a suspected case immediately to your local or state department. So that's a law. Now, in a typical life cycle of a anthrax spore, you can see from here, these are the anthrax spore, and then they are there out in periphery, in open. So if they come in contact with animals, cows and sheep, people can either touch them, come across them, use their meat, use their milk and other products. Or if somebody comes closer to these animals or the spores, he or she can touch, have cutaneous, inhale, ingest. And the third important thing is a vector, which we call it biting fly. So basically it can take the vegetative form or the spore form from the human to the animal, or from the animal to the human. So it acts like a vector, a go-between. And then again, you can see a typical respiratory infection over here. Now, I hope that you don't see that ever in your life, but these are some of the pictures by Dr. Chotani, and they've been there just for public awareness as well, for us to understand the impact of especially anthrax and why people are scared, and they do have a good reason to be so. So you can see from here a cutaneous involvement, a typical ulcer. It can be very close to eye, can involve the eye, and very extreme form of, if I was to look at it, I would have thought that they are cancerous, maybe a basal cell carcinoma or a melanoma or squamous cell carcinoma. Look at the crater, look at the edges of the ulcer, but they basically are the lesions of anthrax. The other important thing is that anthrax develops quickly. Cancers may take a little bit of time. So what you see is that a small vesicle erupts, like a small kind of a swelling that has a liquid there, and then you can see day 4, day 6, and by the day 7 it is really malignant. It is really dangerous. So it is a challenge for us to treat. And these slides basically are copyrighted by, as I said, Dr. Chotani, and properly referred in these slides. Another lesion you can see of cutaneous, so you'll see day 7 vesiculation, and then gradually moving to ulceration of the initial macular or papillary anthrax skin lesion. And then in the right hand side you can see a typically a scar. So that happens 15 days of illness, and that pretty much unfortunately shows the typical of the last stage of the lesion, and then again it may be detrimental or fatal for the patient. New England Journal of Medicine 1999, and you can see some other forms of very extreme infections from anthrax, hands and face, and different parts of the world, not necessarily this part, but Africa or other parts of the world. This slide shows you a healed scar after treatment. So that's a good story, that if you are treated in time, you are put on antibiotics on time, and you are treated well, the chances are that you may have a survival rate. This picture shows you the edema, and then also shows you the lesions. And as a word of caution is that whenever you see any skin lesion, don't underestimate it, and don't delay seeking an opinion, because skin lesions are look very simple, but they are not that simple. You need to have an expert opinion on that. And we have a special branch of medicine, dermatology, and to a naked eye everything looks the same, but this is not the same. And as a word of caution, I would also advise you not to ask and seek people take over the counter lotions and creams and so on and so forth, because sometimes the lesions are such that if you don't initiate the therapy in time, it will be not good for the patient, or it may delay the treatment. So always play a word of caution. And also keep in mind that some of the skin lesions may be the early signs of a systemic disease, and there may be something else going on. So that's a word of caution, and I would do that unless you're really trained for do that, because as we say that eyes don't see what mind doesn't know. If you don't know what is it, you will never see that, but it's there. And we do show you some of the pictures, because part of the training is that people, when they look at this picture and then they recall, oh, I didn't know that I had that, I saw such and person having that. Because the thing is that there has to be a little bit of awareness among health related people, at least to pick up a problem and have a good opinion or refer people to the proper authorities. Gastrointestinal anthrax, you can see lesions there. You can see you know tissue damage there. And then of course it was done on colonoscopy or endoscopy. Francisella tularensis, another category A microorganism causing a disease called tularemia. It is also potentially serious, and it does occur in the United States, and it is caused by a bacteria, Francisella tularensis. And this is found in animals, especially rodents, rabbits, and hares. People who get tularemia, they will have a sudden fever, chills, headaches, diarrhea, muscle aches, and then over time they will have, we call it progressive weakness, once the muscle, more and more muscle gets involved. And in the end, people may have pneumonia, they develop chest pain, bloody sputum, and then difficulty in breathing, and sometimes the breathing may totally stop, and that will be fatal. Typical history is that if you ask these people and investigate, there is a history of being bitten by an infected tick, deer fly, or any other insect, or they have been handling infected animal carcasses, or they have been eating or drinking contaminated food that's been contaminated with Francisella tularensis. So the important thing you need to know is that tularemia is not known to be spread from person to person. People who have tularemia do not need to be isolated, and people who have been exposed to tularemia bacteria should be treated ASAP, because as I said earlier, it could be fatal if it's not treated in time. And this is a typical picture of this woman having a swelling of tularemia. It looks like an abscess, but if you were to do a biopsy and you look at the microorganism, you will see a typical bacteria. The third important category A bioterrorism threat is Yersinia pestis, the causative agent of plague. And again, it is found in rodents and fleas in many areas. And why are we concerned about that? Because there's a pneumonic plague as a bioweapon, and just a couple of days before it actually goes out of the hand. The causative agent is Yersinia pestis, and as I said earlier, many a time these kind of bacteria do exist in the environment, but for now we believe that pretty much is taken care of. You wouldn't rarely see inguinal bubo, we call bubonic plague, and that's a typical historical textbook picture for that. And there's a flea there, and you can see that it is teeming with that plague bacteria. Clostridium botulinum again is an important thing, and we will discuss that again in detail as a part of Clostridium. And there are different kinds of, there are actually different types of Clostridium. One of the Clostridium that causes botulinum is the one that causes muscle paralysis disease. There's a toxin release by that particular bacteria that will cause respiratory arrest, and that will cause a big problem. And you can also see it's very bad in terms of causing lethality and problem morbidity, but a good use can be made because Botox, for example, is used to basically treat people for anti-aging. And if you look at the details again, you'll also see that it's very common in foodborne. If you want to go for especially honey, you have to make sure that there is no such contamination by Clostridium botulinum. And then some of the other diseases are there, not that important, but they are infectious to animals, especially Brucella. And this Brucella is primarily passed among the animal, and they cause diseases. And you wonder, why are we talking about that? Because we come in contact with these animals, we eat their meat or drink their milk, and sometimes we have them as pet. But humans can become infected when they come in contact with them or they consume their products. So we have a disease called brucellosis, and it's not very common here, but you can see with 100 to 200 cases every year, but it is there, and we need to know that. And this is an animal disease. As you can see, some parts of the country have a higher incidence: California, Texas, Florida, shown in red, very high incidence. And then again, warm climate will assist that in terms of this bacteria being prevalent and causing more problems uh, in the farmland. Smallpox, to our knowledge, we think is a pox virus. It's been eliminated from the world because of the vaccination. It is also called variola major. Uh, and this is the most common form of smallpox. It usually comes with a very extensive rash and a very high fever. And then we can see that pretty much it kind of takes over the person's whole skin. And if you were to look at historically, this variola major fatality was about like 30%. And it starts with a very small lesion and then expands for the whole body. And sometimes the outbreaks also occur. We had the last case, especially in US in 1949, but in the world we had that in 1977. And I hope that you don't see that in your life, but this is how it looks like. Whole body is involved and everything is there, and then you can see that happening. And then some of the patients survive, and you will see a typical facial thing that is there in terms of the lesions that they have. This is part two of bioterrorism lecture. So we were talking about some of the bacteria and viruses. The other important agent is viral hemorrhagic fever. And again, this basically refers to quite a few viruses, and they cause a group of illnesses. And we kind of lump them together as viral hemorrhagic fever. And they involve multi-system. That's what they call it. We call them a multi-system, affecting viruses, and the whole body is involved. And again, respiratory system, GI system, pretty much as something systemic that goes to blood. And what normally happens is that the vascular system is basically damaged, and then again the body's ability to regulate itself is impaired. Symptoms are often accompanied by bleeding, so there's a lot of hemorrhage there, and that bleeding is itself uh, rarely life-threatening. But what normally happens is that some types of hemorrhagic fever viruses can cause mild illnesses, whereas many of these viruses uh, can possibly cause a severe and life-threatening disease. It depends upon the virulence of that particular group of viruses. When people work on these viruses in research lab, they want to make sure that they are kept at biosafety level 4, and that protects the person who's using it, and also protects the accidental spillage or contamination of that. And there is a department at the Vienna Vector-Borne Infectious Diseases, and also in National Center for Infectious Diseases. There are people who work over there, because we have to come up with the drugs, and we have to find out what are the ways that these bacteria and viruses cause problems. And this type is the injury that you see, the skin lesion, hemorrhage. It can also affect fish. You can see a lot of hemorrhage in the fish and the lesions of this young girl over here on both sides. So these are typical hemorrhages and typical lesions that you will see. So let me summarize that whatever I've discussed so far. So these are some of the characteristics of a typical bioterror agents, and you can see that we have an agent on the left like anthrax, plague, tularemia, brucella, Q fever, smallpox, and other viruses and botulinum toxin. So we have a type for that, and there is a dose that is required, and then again there's a way that this is spread, like inhalation, and what kind of symptom do they give, and what is the duration of system. So this is a very good table for you to pay attention to, and what are the animal reservoirs and how does our body deals with it. So this is a good index, and you can compare and contrast, and I believe quite a few questions are expected from this particular slide. And then finally, as I said earlier before I began the lecture, that what's your role as a pharmacist? I'm going to ask you as well. Well, the most important role that you may have is that don't panic. So you have to minimize hysteria, because many times things are blown out of the proportion. You have to recognize the pattern or outbreak. You have to be very cautious. You have to be prepared for anything, even unexpected. And you have to make sure that the antidotes or supportive therapies are given in not given, maybe given in usual doses or route. So what we call is pharmacovigilance. You have to be pharmacovigilant, and you also have to coordinate with the public health officials. You need to try to avoid hoarding, and then again keep on checking CDC website, because as I said earlier, they keep on updating the categories from A to B and C, and sometimes some new threats may come up, so we have to be familiar with that. And also keep in mind that there is a national pharmaceutical stockpile. So if we need some drugs that are particularly effective on they are maintained by CDC. And then again, you need to coordinate with metropolitan areas. And then again, there is lots of supplies that we have, fortunately. So you can see from here, there are 12 separate 50-ton kind of push packages that can be supplied within 12 hours to treat anthrax, to treat smallpox, to treat plague, to treat tularemia, to go after botulinum toxin, and even treat viral hemorrhagic fever. So we have to be prepared for that. And then again, also keep in mind that you also working in pharmacy follow a vendor managed inventory material. And then finally, are we really prepared for something that's coming in the future? You never know. So you have to read the news and want to make sure that everything is there, because CDC recently is talking about some of the new targets. That's why they included E. coli, Salmonella, Staph, and Shigella. That is going to the next target for bioterrorism is your food. And this is the whole plan and kit that you may wanna read and study and find out what is it that is required in terms of us using it.